Hi, this is Dr. Leslie Franklin from the Institute for Transformation and Change, here to talk today about the issue of the impact of trauma on learning. This is an especially important topic in terms of kids who are in school who often have a difficult time learning due to trauma they've been exposed to. It's important to know that when you've been exposed to trauma, that it impacts the development of the brain, particularly the reward and pleasure center. So students and children often have a hard time feeling as if they've done something right, or um, they often don't feel like anything they do is good. Um, Mostly because children who have been abused or neglected develop secure attachments. And when you haven't had secure attachments, it can be really scary for a child to trust that the teacher or classmates are going to treat them in a way that's kind and caring, as that's not been their way. Or behavioral regulation, and what that means is traumatized children often have a difficult time managing strong emotions. The reason for this is due to the fact that as babies, they were never taught how to self soothe, due to the fact that they never received from the parent calming and soothing, which allowed them to then understand how to soothe themselves, which means there's been a lack of a secure attachment here also, which contributes to chronic dysregulation in their behavior. Often hard time sitting in the chair, impulsively putting up their hand, difficulty communicating with other students, forming friendships, etc. The other aspect of trauma and the impact on learning has to do with negative thinking. Traumatized children tend to develop what's called an hostile attribution bias, the idea that everyone is out to get them, that no one likes them. So if a teacher says to a child, please sit down in your seat, they often hear it as, sit down in your seat. This is an exaggerated way of hearing it, but it also causes the student to feel angry and as if they're being singled out, which in turn then causes them to act out. They see negative where most other children and students see neutral. It causes them to have a narrative about themselves that they're not good and that they're a bad kid and that nobody likes them, which then again impacts their ability to focus and concentrate and to learn. The fourth issue would be hypervigilance. One of the classic symptoms of trauma is hypervigilance, which means being overly alert to danger. It's also called psychological hyperarousal. So if anything around you seems out of place or unfamiliar, you can suddenly have a very strong reaction, and which can lead to a fight or flight response where a student feels like they have to get away from the incident, or they move towards it, becoming angry as a way to protect themselves. Hypervigilance is a huge issue in schools due to the fact that it's often why there's so many fights and disagreements for students both in and outside of class. The last one, and one of the most important, is executive function. Executive function is definitely impacted by trauma. And executive function is the ability to plan, organize, and follow through. It's also an ability to pay attention and to be able to finish tasks. And this is an area which kids who have experienced trauma have a really hard time with. And often it's misdiagnosed as ADHD, when in essence it's not ADHD, but it's trauma. They also are, with executive function issues, they have a hard time with an ability to mentally talk themselves through what they need to do and then carry out the task. And a lot of this has to do with negative self-talk, ability to plan, and just a lack of cognitive development in terms of the brain. So it's important to note that 2/3 of Americans have exposed to trauma, which says a lot about how many kids in urban schools are probably struggling with this issue of uh, difficulty learning. And it's an area that has actually been addressed pretty strongly recently by Dr. Nadine Harris-Burke, who started a clinic in San Francisco where she realized that many of the physical symptoms were actually emotional symptoms that had been caused by adverse experiences and trauma, which led to an assessment called the ACE assessment, which helps to identify where students are in their readiness to learn and how severe the impact of trauma has been on them. If you have any further questions about this topic, we'd love to talk to you. Again, Institute for Transformation and Change, Dr. Leslie Franklin, www.institutefortransformationandchange.com. Have a great day, and we'll be back with you soon with another topic.